Discussion series on cyclic vomiting syndrome and hyperemesis gravidarum and how they're both related to each other. It's a question that I get asked all the time. So today, in this video, I'm going to answer it. If I don't answer a question that you have about it, drop it down in the comments, and I'll be more than glad to make a follow-up video on it. Cyclic vomiting syndrome is a severe nausea and vomiting disorder with sudden repeat attacks, also called episodes, of severe debilitating nausea, vomiting, physical exhaustion, and abnormal drowsiness, pale skin or bright red skin from mast cell activation disorder, not wanting to talk, drooling or spitting, extreme thirst, sensitivity to light, dizziness, diarrhea, fever, conscious coma, belching, screaming in pain, being extremely cold or extremely hot, and wanting to take hot showers because some patients get relief that way and others don't. But you'll get accused of having CHS, cannabinoid hyperemesis syndrome, if you tell a doctor about the shower part. Sensitivity to sound. So I wear noise canceling headphones and they can help you. Also wearing an eye mask because sensitivity to the light and the sound is vital to a CVSer. Sensitivity to noise and sound is huge. I get startled really easy, and with my dysautonomia, I have to wear 24/7 noise canceling headphones. So if you ever see me in videos or photos, I always have headphones on, because for me, I cannot concentrate and focus unless I have noise canceling headphones on, because everything is so heightened when your autonomic nervous system is broken, malfunctioning. And this could be something that could really help you that you didn't even think about. I also have something called long QT syndrome, and if I get startled, my heart could just stop and I could die at any moment. It's pretty scary. Many CVSers fall into what I call a conscious coma. A conscious coma is you're able to lay there and you're aware of your surroundings and everything, but you're like catatonic. You only have enough strength to vomit, and that's it. And it used to happen to me really bad. Like when I started to get sick, I knew my body was going to start shutting down. I had to get in the bed to get safe, because it just, everything inside me was shutting down, and I was going to be in that bed and be in the conscious coma and couldn't do anything about it. Over the years, my CVS has changed, and I'll share with you guys also the things that I do and use that have been game changers in my life. These episodes can last for days, weeks, months, even years. Yes, years. See, the medical community doesn't think that you can have chronic CVS and be sick every day for very long periods of time. They're just not educated on it. It's one thing to go to school and learn about a medical condition. It's a whole nother ballpark when you live it and you go through it, because really that is the best way to describe it. Patients can describe it so much better than any doctor, because you're living it and you're going through it. The episodes can be so severe that you're unable to work, go to school, care for yourself, or care for your children. You can barely even function. After having hyperemesis gravidarum, my abortive medications changed, and I had to do Zofran shots, IM injections in my butt to help me, and Ativan to try to abort, and my Xanaflex, my attacked. And I would get bullied all the time. I get accused of having hyperemesis cannabinoid syndrome, because that's what these doctors that are uneducated learn. They learn about cannabinoid hyperemesis syndrome, which is identical to it, and they'll say hot showers and everything are the classic symptoms. But somebody with CVS, actually, it helps the vomiting central part of your brain to stop vomiting. These are what medical professionals don't know or get it. Do people get hyperemesis cannabinoid syndrome? Yes, absolutely. But for the majority of CVSers, cannabis actually helps CVS. CVS does not discriminate. You can be a boy, you can be a girl, you can be a man, you can be a woman, you can be a baby, you can be a child. Even dogs get it. You know, it does not discriminate.
Come up in my next video. Thank you for watching. Sharing is caring. Like this and follow me.